Welcome to this very special edition of the KJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have with us Dr. Jess Armine. He is a functional medicine practitioner, nearly 50 years of clinical experience. And we'll learn from him about why some patients, why so many patients fail to recover with conventional approaches, what are the first steps to real healing, how does that look like, and how a root cause systems-based approach can restore regulation where other methods fall short. Welcome to the show, Dr. Jess.
Thank you so much. I appreciate you having me on.
You are welcome. Welcome to the show, Dr. Jess. Welcome to India in this online form. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to talk right now. We'll talk about chronic illness, we'll talk about fatigue, we'll talk about root cause healing, we'll talk about all this. But before that, let's talk a bit about your journey, your background, so that the audience knows who they are listening to.
Well, I've been a healthcare provider in one form or another for 50 years. I started out as an EMT paramedic in New York City, and I went to college for nursing. I became a registered nurse in 1978. I served in our military for 4 years as an Army nurse, and then decided to go to chiropractic school and graduated from that in 1986. So I've been a physician since 1986. Most of my traditional medicine background was in emergency department nursing and critical care nursing. So I have a large background in not only pre-hospital emergency care, but in hospital emergency care. As a chiropractor, I practiced standard chiropractic for a while, but had an interest in various types of alternative medicine. And my middle son developed schizophrenia. And as a result of that, the medications were taking this very intelligent, good young man and turning him into a non-entity. I decided that this was not the proper approach because I don't think we could live like that, and started learning many different things. So to make a long story short, I became an expert in genetics in a concept called neuroendoimmunology, which combines neurology, endocrinology, immunology, mitochondrial dysfunction, cell membrane integrity. And as a result of that, and learning all these things, my son is now, he's 38 years old, he's a graphic artist, his full-time job. He's not back totally to himself, but very much to himself. Of course, if you would listen to Dad, because I'm Dad, he'd be much better, but that's another story. But the accumulation of that knowledge allowed me to take care of people with chronic illnesses who had failed in numerous other therapies. Essentially, I noticed a pattern in people with chronic illnesses, and they had many different diagnoses: chronic fatigue, fibromyalgia, autoimmune diseases, so forth and so on. Yet, they weren't getting better. They were being managed rather than cured. So as I delved into that, especially from a genetic point of view, I found that there was one, if you will, stone left unturned, and that was addressing the foundation of the body, or what people are calling today terrain therapy, which is getting the biology, getting your cells essentially to function. Traditional medicine says if I take care of the root cause, the body will heal itself. And if the body doesn't heal itself, I'll just manage it. And if you look at medications, and I'm not anti-medicine, I'm not anti-anything, so I'm right in the middle. I have knowledge in both ends. But the concept is that, well, if we can't cure it, then we'll just manage it. The problem in that concept is the concept of curing, or relieving something, or getting this body to work again. That area was largely unexplored and largely untreated. It was assumed that chronic illness is permanent. It is not. And when I started applying these principles, people who were previously given no hope or said, well, this is your life and we're just going to have to deal with it, excuse me, started thriving again. Many times their diagnoses were eradicated. In other words, their symptom complex was gone, sometimes quickly, sometimes slowly, depending on what it was. It does take an awful lot of uh, investigation and knowledge to get into the individuality of some of these issues, but the base of it is that if we return the physiology back to, if you will, an infant physiology, where everything is working, then people started healing, even from the worst diseases.
Absolutely, absolutely, Dr. Jess. So, how would you like to tell people what you are trying to do with what you are doing?
It is a bit of an uphill battle, and not really because most of the people, my practice is taking care of complex multifactorial illnesses that have failed elsewhere. So I tend to get very complicated cases who are very upset, and but they have a feeling that something can be done. I don't have to live like this. And I teach first of all, I have a patient practice. I also do an awful lot of lecturing. I'm close to 70 years old, so I'm passing off a lot of the knowledge to other practitioners. And what I'm teaching them and what I teach my patients is that if we get the cells working again, you know, your body will start working. And people kind of look at me cross-eyed and I say, listen, if you put cells together, what do you get? Tissues. If you put tissues together, what do you get? Organs. You get a bunch of organs that are working with one organism, now you have a body. So instead of treating from the outside in, truly I treat from the inside out. Of course, I'm very, very good at explaining complex things simply. And it's always wonderful to look at the light bulb going off or that twinkle in their eyes saying, oh, that makes sense. Okay. I'm not selling them a bit of goods. I don't have my own vitamin line or anything like that. I have methods of diagnosis and treatment, but I don't have a protocol. The Armine protocol is not there. I treat everybody and I look for the individuality of that particular person's problem and address it in that manner. So once the idea is put across and accepted that there is another way, there is hope, because this is the stone left unturned. And when it's explained that if we work with the biochemical processes, and again, it can get very technical and very scary and maybe very impressive if you're impressed by somebody pronouncing polysyllabic terms, okay, okay. But once the idea is put across that the things you've been diagnosed with are not permanent, and there may be another way to help you, um, it it flourishes. Unfortunately, it has to be done one person at a time. I've published papers, but it's the vast majority of the world ascribes to the traditional medical model, saying that things like mental illness, things like autoimmune diseases, things like other chronic illnesses, fibromyalgia, chronic fatigue, and so forth, are permanent conditions. And in this time frame, we have long COVID or long haul COVID or post-vaccination syndrome, which I've been on the forefront of diagnosing and treating very successfully. And people are not cognizant of that there is something to do. And even breast implant illness, which doesn't usually show up until 5 to 10 years after the implants. It takes a bit of legerdemain to figure it out. And when those people look at their physicians, they're like, oh, can't be that, can't be that. Well, even if you use a diagnosis of exclusion, you check everything else and it's not there. What you're looking for is not there. Instead of saying it must be the breast implant, very often when doctors investigate a chronic illness or go along their algorithm and say, well, I've done everything I can. I've checked this, that, and the other thing that's not there. Where they go is that you have a psychological illness. Okay, that's just simply not true.
Absolutely. So, Dr. Jess, you talk about, overlooked biological drivers behind many of today's chronic and neuropsychiatric conditions. Help us understand that and How can general patients can address this part in their health journey?
There are some very simple things, but let me explain the process of my thinking. Okay. First of all, I learned how to be a doctor from very old doctors, which means I learned how to take a history, which takes some time, and figure out from what somebody says to me what was going on. And that's the first thing to do. Unfortunately, in traditional medicine today, they are forced into very short encounters with their patients, which unfortunately doesn't allow them to take the time. And trust me, I have a lot of medical doctor friends who are incredibly frustrated by this. But I do take my time. My intakes take about 90 minutes. But I will find out what's wrong just from the intake. Okay, I don't depend solely on testing. So what am I looking for? Well, I do know that because I'm also a genetic expert, that if I look at the biochemical pathways, the genes, which create enzymes that turn one thing to another, to another, to another, okay, so they can be used in the body, those enzymes need cofactors, which are vitamins and minerals. And very often in our society, we're not getting those vitamins and minerals because of the foods we eat and because of the toxins and so forth in the atmosphere and what we're eating and so forth. So that's one factor I'm looking at. Okay, and the biochemical pathways that innately don't work very well, that's where it's going to express. And that's where the knowledge of genetics may give you some hints. And remember, concerning genetics, real quick, when you were a baby, you're working just fine. So the genetics that you have, the polymorphism, SNPs, or whatever you want to call them, were there at birth. It's a matter of oxidative stress that causes those things to express. So how do we get all this oxidative stress? Well, we live in a pretty toxic environment. And given that, those enzymes are exposed to toxins and that will allow them not to work as well, especially in the mitochondria, which is the powerhouse of the cell. Over time, we get exposed to toxins, to microbes. And there was a paper done by Robert Navio, MD, PhD, on something called the cell danger response, which is how cells respond to attacks. He divided it into toxins, which makes sense, microbes, bacteria, parasites, viruses, and so forth, and all the psychological, emotional, and spiritual traumas that we face. And he proved this on a scientific basis. Up until that time, it was considered that if you had trauma, yes, you'd have psychological problems, but it didn't really make the connection with actual dysfunction in the body. Since then, there has been scientific evidence that, just to use an example, that depression and anger can cause inflammation, something called pro-inflammatory cytokines. When I say a big word, ignore it because I'm going to explain it in the next 5 seconds. I don't want you to be impressed that I can pronounce big words. Okay, it's just not important. It's important that you understand what's going on. So, when this cell danger response happens, the cell does several things to kill off whoever the invader is, and then goes back to normal. Okay, an example of this: most of us have had, let's say, strep throat. Okay, you feel terrible, and your doctor gives you some antibiotics. After a few days, you still feel terrible, but then there's that one day that you turn the corner and you start getting better rapidly. That's when the cell danger response has reversed itself and take you back to normal physiology. When those cell danger responses become chronic or multiple or a combination of both, the turning back to normal doesn't happen. So there's a level of dysfunction that downstream creates chronic inflammation, either through leaky gut or allowing microbes to multiply by becoming an acidic environment. But the chronic inflammation that occurs from that is the base of almost all illnesses. If you look into chronic, ongoing inflammation, chronic inflammation, oxidative stress, same thing. Okay, they will create things like autoimmune diseases and so forth and so on. Many different expressions from the same base. That's the area that is missed, if you will. Okay. If we know that, If you know that your neuropsychiatric problems are essentially from chronic inflammation, if you know that your autoimmune diseases are from chronic inflammation, if you know that anything you have has a chronic inflammatory component, now you've got something to treat that will improve the condition generally, may sometimes eradicate it. The other concept that has to be understood is that you may have root causes, Lyme disease, uh, Epstein-Barr virus, toxins, and so forth. When it goes on long enough, it's done damage to the cells, and that has to be addressed as well. You can cure the root cause, the cells will still remain sick, and you will look like you always have illnesses. But if you take care of the root causes and reverse the cell danger response by giving the cells what they need to work, and then, if you will, filling up the cells with what they need. Let's say it's a neuropsychiatric disease. Let's talk about OCD. That's usually an imbalance between the excitatory and the inhibitory neurotransmitters. If you balance those neurotransmitters, you're going to have to do that inclusive of a basic program that I like to call foundational treatment that gives the body back what it needs to do. And you have to consider the root cause. It's not all that hard. Okay, if you consider the fact, if you look at somebody's history and you see that they've, and I've had lots of cases like this where they've taken care of all the root causes, yet the person's still sick. Guess what? I know what to do. Okay, you need to feed that body what it needs to work. Absorb the vitamins and minerals, fix the leaky gut. Look at the particular expression and say, they need more serotonin, and so forth and so on, things like that. And slowly return the person back to normal function. In this time frame, since the pandemic, we have to be considerate of the fact that the spike protein from COVID, which is that protein that goes into the receptors and prevents a lot of normal functioning, especially in the mitochondria, has to be considered. How do you know if you have that? Okay, well, if you were sick before the pandemic and then you became worse but never came back to baseline, that's the spike protein. If you weren't ill and then you got ill during the pandemic or soon thereafter, and you never came back to baseline, that's the spike protein. So that has to be put into the treatment program. That is reversible. Many things are reversible. Okay. So when I look at somebody, I'm saying to myself, okay, here's an expression of chronic inflammation. What's causing that? Leaky gut syndrome. Okay, what's causing that? Okay, and go backwards. What I found is that you can identify the root causes, but if you include your treatment to treat the body's or the cell's basic function, and then what the damage particularly is, okay, that gets pretty not really complex, but it goes into different areas of what you should do, and make sure the root cause has been taken care of. Usually, once you give the cells back their ability to work, you're essentially giving the immune system back its ability to work. With all that chronic inflammation going on, it doesn't matter what you do. Yes, you can compensate, you can manage it, okay, manage symptoms, but you don't have any curing going on, and they get progressively worse. Example of that: somebody with an autoimmune disease, or if you've ever noticed it, no one usually has one autoimmune disease. They usually have a few. And that autoimmune disease can go to something called dysautonomia, which is dysfunction of the autonomic nervous system, giving you things like POTS or fainting, or a lot of different things that you would normally automatically balance. Once the inflammation gets to a point, you're just going to start seeing that. So reversing that process, which is done by giving the body back its ability to function again, is the primary first thing to do. This is something you can do on your own, by the way.
Right, right, Dr. Jess. So, when do you come into the picture? What is your role in a patient's life?
Well, normally, and which am very passionate about, by the way, I really enjoy doing this. Not because I don't enjoy seeing people sick. I enjoy that feeling of there's something I can do about this. There's something I can do for you. Okay. Once I've taken I offer in my practice a free 30-minute, what I call a discovery call or get acquainted call, which, we can discuss the case. And, once I accept the case, I'm like, I very much know that I can help them. And I love that feeling. So when do I come into this? Is when you've been here, there, and everywhere, or you're just simply frustrated, or your physicians and family feel that you have a psychological problem rather than a physical problem. Okay, and your inside, your innate intelligence, your intuitive sense says, ah, there's something that can be done here. Okay, that's when I come into the picture, because what I'm known for is putting the puzzle pieces together. As a matter of fact, my nickname in my profession is the Sherlock Holmes of chronic illness. I often lecture with the Sherlock Holmes hat on, because I'm acting as a detective. And I have enough experience that I can look at a condition and a set of circumstances and figure out what was done, or more than that, figure out what wasn't done.
Absolutely. There's so much to learn about all this from you, Dr. Jess. And I'm sure a lot of people would want to connect with you. What's the best way for them to do so?
Well, you see my name here, Dr. Jess Armine. Just put them together without the space, okay? And go to my website, drjessarmine.com, and you'll see a way of clicking and making that 30-minute appointment. I have a worldwide practice. It doesn't matter where you are in the world. Okay, I'm set up to work with you. And if perchance you can't find an appointment because you're in Japan or you're in Australia or wherever, and it just doesn't seem to be my schedule, all you simply do need to do is email me, which is Jess, my first name, at drjessarmine.com, and tell me, where you are, and we'll figure out a time together. Okay? Of course, my schedule has a certain time frame in it, but I can accommodate almost anyone. And then we can just sit and chat. I'm not a predatory person. I don't put pressure on people. I simply want to know if I can help you.
Absolutely. With this, it's a wrap on this very special edition of the KJ Masterclass Live. Thank you so much indeed for joining us.